All right, everybody, I'm going to kick in this morning. My name is Gary Walker and welcome to our morning webinar. Unfortunately, we've had a few technical issues getting started, so we're also happy to look at repeating this at a later date. But certainly welcome and thank you. I know that it's a webinar and we're not all sitting in a meeting room like we are, some of us, at the hospital right now. So in light of what's currently happening, this is a lot safer. And there's also a lot less carbon, so it's a double win for us. A little bit of housekeeping. If I can ask that you'd all remain on mute. There is a chat box that you can sit and tap some ideas with. And the position will be recorded and sent to everyone. But it's good to get some learnings from today. Well, in today's crazy, I almost call it, we're almost in a movie world, with AKA Mad Max, zombie movies, pandemics. It really feels like we're at the top of a cliff looking down and hoping we're not going to fall off. We definitely need a better future. We need a better society. And today is all about looking at what we can do across the health sector using the Sustainable Development Goals. I work here on working on a project around the SDG alignment at the Auckland ADHB, and I work as a sustainability leadership coach. I work with Manjula Sickler, who's also sitting in the same room and who'll be talking a little bit later. And we'll hear about the wider application across this. And Sophia will also chat around the framework and the assurance from Toitū Envirocare. Unfortunately, I can't see if there's any chats coming through, so I'm going to rely on my co-presenters to say if there's any comments coming through on this. So let's just dive into a poll. I'll ask Bronwyn to quickly flick open and jump to the poll, if you can. I'd like to understand how many people know and understand about the SDGs.
Hi everyone, so thank you for beginning to put your answers in. So Gary, just to let you know, we've got about 25% of participants have clicked on an answer, and we're just working, and maybe if we give them 1 or 2 more minutes, and then I'll display and I'll let you know what the answer is. About 50% of people have put in their answers, so if there's anyone still hesitating, quickly jump on what you think represents your organisation the best.
All right, how do we go? What is the general consensus, Bronwyn?
Wonderful. So I'll just display those. So it looks like the majority of people said that they were comfortable talking about the SDGs. 1 or 2 said that they were, or 1 said that they were, first time they've heard of them, a couple that they were aware of them, and then a couple where their organisation had taken some steps to include it in their reporting, but no one has said that their organisation had integrated them into their sustainability strategy or that they were using them as a framework to transform the business model.
Fantastic, thank you. That's very similar to most of the expectations we have had on this and what we have seen. So thank you very much. And for those who don't know what the SDGs are, they stand for the Sustainable Development Goals, and I'll actually touch a little bit on them in another slide. A little bit about us. Auckland District Health Board is a large teaching hospital. We have around 40 theatres, 1 million patient contacts per year, is about 11,000 staff, making us, as we've been told, the 10th largest health board in the world. There's a big carbon footprint for us from our vehicles, from our energy, and we're certainly using a lot of water and waste, and you can get to understand that. Today will be a bit of a journey. We're going to start with sustainability. We're going to link that to climate change, and we'll link climate change to health. We'll link health to the SDGs, and then we'll link the SDGs back into sustainability. So I'll talk a little bit about the journey. We'll talk a little bit around our SDG project, and Manjula will chat around widening the scope, and Sophia will finish off today. We look to be about 45 minutes. So we're bound by our guiding maxim as a health provider. However, this challenge, and this is the challenge that I say not just for the health sector, I think it's for all. It's for all of society to start doing a little bit better right. We need to start benefiting people and contribute to their welfare. That's an important point for us to kick off. But as a matter of interest, what does sustainability mean? I talk to a lot of people about sustainability, and when I say what does it mean, people say coffee cups, they go climate change, they go transport, they go renewables, solar energy, they go waste. It means a lot of different things to a lot of different people. Climate and waste is actually a great way to start a conversation around sustainability, because sustainability is way more than just climate action. In today's organizations are recognizing that true financial sustainability is about reporting on what they call the triple bottom line, which is both the environment, the economic, and the social elements of any organization. So an organization should have financial sustainability, an organization should have good social sustainability, and that includes looking after equity, their culture, as well as all their climate, as well as looking after biodiversity, waste, and water. So it's a lot more than just climate change. But most people think of sustainability as plastic bottles, coffee cups, and that's it. And that's why I wanted to make sure everybody starts to recognize that it's way more than just climate action. But before we get to the SDGs, let's tackle that climate change and the impact on health and the impact from health on climate change. At the last presentation we did, we spoke a little bit about the challenges that we were facing. And at that stage, we had bushfires, we have waste, we have climate marches. They all seem so far away given the current challenge that we're having right now with the coronavirus. On a side link, it's interesting how the virus outbreaks actually reduce carbon outputs in some areas just through reduced manufacturing and air flights. I'm not too sure this is an upside, but the link is still there. And I'm more than certain that the link to climate change, the adaptation we're doing now for coronavirus, is going to help us adapt to climate change in the future as well. The link is not specific, but the rising heat that has been caused through climate change has led to new virus strains to be more resistant to our body's use of fever to control this. If we add to this migration habits for wildlife, floods, city living, waste, overconsumption, and overpopulation, the future of the epidemics is even more uncertain. And we're seeing that right now, talking from the hospital where we see this right now. This is a diagram that gives you a little bit of information, seeing what we can see right now, the impact of climate change on client health. And you'll notice in the top right-hand corner, it talks about vector-based viruses, and you'll see that COVID is not even there. So when this was created, these things don't exist. So what else do we not know yet? At the beginning of the seminar or the webinar today, I spoke about us looking down off a cliff. And there's an old analogy about a cliff and an ambulance at the bottom of the cliff to pick up people. And sometimes we need to think about the fence at the top of the cliff. But right now, we, as the hospital, are definitely the ambulance at the bottom of the cliff. So we are affected by, but we also affect climate change. Our ADHB footprint, combined with all the other DHBs in New Zealand, all the DHBs around the world represent around 4.4% of the climate footprint of this earth. It's very important that we can actually play a vital role in mitigating our climate impact. So climate change is a health issue. We affect climate, and we're definitely affected by climate. We can support by mitigating some of the stuff that we do to reduce the amount of stuff that we do on climate, but we must be ready to support how we are being affected by climate change. The Zero Carbon Bill, recently enacted in New Zealand, has seen health boards be acted as a lifeline utility, and we need to show that climate resilience. So we really need to have a good assessment of our risks to balance short-term delivery of our services and supporting people against long-term strategic outcomes. Dr. David Pension, who was the lead of the Sustainable Development Unit for the National Health Services over in the UK. This is an article that came out a little bit about him, how hospitals are making people sick. Well, I guess this is all about the climate impact that hospitals have. And the message was quite simple. It said, if you knew how many people were admitted to hospital as a result of your car's greenhouse gas emissions, would you act? And it was a call onto the hospitals themselves to do something different about their climate footprint. There's a lot of medical waste, there's a lot of travel, there's a lot of emissions coming from hospitals. Our goal is to try and change the conversation to say we're giving good care and health for now and for the future for both environment, but now also to social and now also to the economic. We need to start providing for the now and for the future. In New Zealand, the government has brought out Rule 16, which is rules of sourcing. And it says if anybody is in the government area and wants to go and buy anything, to go and procure any services or products, we need to make sure that it fits the broader outcomes. This means does it improve conditions for New Zealand workers? Does it reduce emissions and waste? And this means that we're taking a situation whereby we would look for something that normally is short-term cost saving and look for the longer and better outcomes at the end. So how do the SDGs link to social and health outcomes? Well, these are the SDGs. And for that, I think that one or two people that didn't know what it was the goals created in 2015 by the United Nations. And I know that Sophia will talk a little bit more around it, but it was to make a better and more sustainable future for all. The end goal was to go make sure that every country actually was doing better. Behind those goals, there are around 169 targets. And out of those 169 targets, there's about 31 of them which are very health-specific related. And here's an example of some of those health-related SDGs. So, for example, under SDG 4, which is around quality education, this is supporting high-quality education for all to improve health, health equity, and health literacy. So these are specific to our health. Now, the ones that are bold in this page are the ones that we can control and impact directly to support the others. If we do good with responsible consumption, SDG 12, we can do better for other good outcomes. We're also going to be careful how we impact on the SDGs. For example, a hospital, we might use, and you've seen it, a lot of water. So how does that impact on SDG 6? We need to understand where we can both positively impact an SDG and where we can potentially negatively impact an SDG. So the SDGs will help us provide that link between climate change and health. They will help us look at a systems approach to future-proof our health. It's going to use a lot of evidence-based engagement. And we're going to look at a health co-benefit. So if we fix one thing, if we provide decent wages and we provide decent work through SDG 8, we will also provide less hunger and less poverty out into the marketplace. So where can we have some really solid links between what we do and health? In New Zealand, we have the Living Standards Framework. It's a tool that emphasizes the diversity of outcomes that are meaningful for New Zealanders. Basically, it's a measurement tool. It's going to help provide economic policy advice to the government. And it's this tool that allows us to measure our impact on how we're doing against the SDGs. And there are some links to that. So how does this flow? Well, if we help somebody and we do anything, if we have any data insights from our public health, that data flows into our mantra. How much are we helping New Zealanders to live well, stay well, and get well? That data then flows into the Living Standards Framework, and that flows up into the global SDG dashboard. And here's an example. This is our New Zealand Wellbeing Dashboard, and you'll see we're measuring at the moment, there's 6 on this page, for example, amenable mortality, health equity, spiritual health, suicide, and health expectancy. You'll notice under health equity, there's no data at this stage, so there's still measures being found and how we can actually get that data. But all this data then feeds into an SDG dashboard, Sustainable Development Goal Dashboard. I've chosen one of those measures, and this is the under 5 mortality rate. rate, probability of dying by age 5 per 1,000 live births. Currently, the value is at 38.6. That's how many people are dying by age 5 per 1,000 live births. Our goal through the world is to get that. I don't know why that's jumping. Somebody, sorry, go back to that. Our goal is to get that to 12. New Zealand is 5.7, so we've actually done better than the goal. The country on the very far left-hand side is actually at 120, which shows you the scale of the impact. So whilst we're doing okay in this goal, we can do so much better in other SDG targets. We can do so much better in equity, in climate, mental health, obesity. Just sticking with that, for example, this is SDG 2, which is zero hunger. And what does that translate to? Well, currently in New Zealand, 1 out of 5 children go to school hungry. 23% of the elderly population is malnourished. And our most vulnerable communities are most exposed to our country's obesity crisis. So we have our challenges. We need to do better. So what have we done? We decided to have a look and see how we can raise our standards. We have some challenges. As mentioned before, most people just see paper cups and plastic. We need to start getting people to look and just being passive around sustainability, being more proactive. From us just looking at our local hospital to being more regionally based, more wider based, we need to look at how our culture and practice are done. I don't know why this is changing. And we have to do this within very finite resourcing. So why are we doing this? Well, we've got a great leadership team here, and our executive team set a challenging goal to us. Get out there and go and look at a wider focus of sustainability. So that meant get out there and go and put the SDGs into the organization's strategy and business as usual. This was endorsed by our board, with Te Tiriti Watangi at the center of this. The first stage is called the materiality assessment. What is a materiality assessment? Well, this was us understanding how we can actually be relevant and measured at ADHB. It was saying which of all those SDGs we just read now are important. I know that Sophia is going to talk about that a little bit later on, but it's very easy for us just to go, oh, we'll take a guess. Well, actually, no, we can just look at our Auckland DHB vision and values and see which ones they mean. So if I look at it, we have got healthy communities, there's SDG 11. We are achieving stuff together, there's SDG 17. So we can do a quick look at our business plans and come up with our SDG, what's important to us. But it's not there, it's not good enough. We need to ask all our stakeholders what were the important SDGs. We need to focus where it matters. So we went out and we spoke to a lot of stakeholders. This includes iwi, our patients, we asked our staff, leadership, our planning arms, our funding arms, Pacific and Maori Health. We even asked other DHBs. We said, hey, what do you think is important? Do you know about the SDGs? Can you rank your understanding? How good do you know it? And if they didn't know what the SDGs were, we went and undertook a lot of education. We showed through workshops, video and online, so they could get a good understanding of what the SDGs are. Some good expectations and good outcomes. The staff survey said actually, barring health being the most important thing, sustainable communities and equities are the most important. Our patients saw water and education as being key priorities with good understanding of the SDGs. Some of the feedback we got is, for example, thank you for making the survey available not only to business, but to youth, grassroots groups, and mana whenua. Working as a nurse, I see a lot of poverty and people that are struggling to feed themselves. It's a big issue. Or we would love to see more movement in the operating room towards recycling, reducing waste items like we used to. So some good feedback. Patients were just as vocal with their feedback, and this is just a very small sample of how many we had. Some of the patients turn around, all the SDGs are relevant and interlinked strongly. I originally had a few choices, but I really had to think about which was more important to us. And thank you for looking at this. So what happened? Well, all the stakeholders made some choices. We had a look as an organization, and we had very good alignment between what the stakeholders feel and what we feel we should do as a hospital. The priorities, we had over 400 responses. There's good awareness. The priorities started with number 3, which is good health, 10 equity, 1 no hunger, 11 good communities or sustainable communities, 6 clean water, and 4 quality education. Those stood out as being the most crucial. However, that materiality assessment, for which we received assurance from Toitū that we've done the process right, is good. We now need to align it to the next stage. There's a couple of things we can control, and there's a couple of outcomes. So we're going to focus very strongly on health and partnerships. We're going to focus very strongly on equity, decent work, good education, and good procurement and consumption. If we do all that right, we will have better climate action, safer water, better nutrition, reduced poverty, and sustainable communities. So we've got ourselves very clear on what our path is. We don't have to do a lot of work to change. We already do a lot of this in our service delivery. We're going to focus a little bit more on the key things that we do better. All the outcomes we will put into will go into the living standards framework, and that will feed into the SDG goals and targets. So some key takeaways, just before I finish. We already align, we're just going to measure a little bit more. We do a lot more than just carbon and waste. I think that's a very important thing. Our strategy works with the SDGs and links social, environment, and economic pillars of sustainable development. We have to think more than just our own ADHB. We have to think wider. But what we really need is good champions. We need leadership. This is not just leadership at the top, this is leadership at every level of the organization, every level of society, to come and stand in to help and make sure that no one gets left behind. I'll leave you with this page before I hand over to Manjula. This is a vision of how those SDGs can translate into our organizational well-being vision, with systems thinking and leadership at all levels to transform our world. I spoke about how we improve health by building better fence at the top of the cliff rather than getting more ambulances at the bottom of the cliff. To me, I think the SDGs and just having good sustainability will help create that fence. We are the ambulance at the bottom. We actually do a better job ourselves as well. So thank you for that, and I'm going to hand over to Manjula.
Oh, thank you, Gary. That was brilliant, and I must say, look, this has been a wonderful journey for this organisation. We've engaged with a much more broader level of people who come into contact with the organisation, the staff, the executive. It's been much, much richer. It's helped to redefine ourselves, our commitment with a common goal, which is to improve the health and well-being for not just our population, but all of our society across New Zealand, and also take the learnings that we demonstrate as one of the key leading organisations in the country, demonstrating that the SDGs are a way forward for every organisation and for all of New Zealand, in order for all of us to improve the lives of everybody across our country. The stakeholders identified what was really important to this organisation and those key SDGs that Gary has pointed out. So adopting this journey, the SDG journey as I call it, heralds actually a new way of thinking, and one that opens new doors and opportunities for much, much greater collaboration across different sectors and organisations that can all help improve our society and the well-being of our people. And at the same, meeting our Treaty of Waitangi obligations as well. When we initially started this journey with Gary, we were not aware that the government was preparing the voluntary national review, which was presented to the UN last year. We were unaware that there was another group of NGOs, academics, researchers, and community organisations that were also preparing the People's Report, which is on the 2030 agenda for the Sustainable Development Goals. The government and this separate group have all recognised that it's important for New Zealand to move forward together, and that it is up to us, each individual organisation and each individual to make a difference for everybody. We have to demonstrate that through the work we do and how we engage and how meaningful that engagement is in order to create some action and momentum to progress the goals. We face enormous challenges to combat climate change and other social issues. The recent passing of leading environmentalist Sir Ralph Fenwick, he spent most of his life advocating for the preservation of our natural capital. In his last speech, Rob says he drew parallels between coronavirus and our environment. He said coronavirus is not that different to the threats of our biodiversity, his experience every day with the threat of extinction, and that time is running out for our precious environment. And he said we have to all pull together, businesses, suppliers, consumers, individuals, pull together and drive innovation to combat climate change, to create a much, much more balanced and equal society. In her foreword, Jacinda Ardern writes in the VNR, we must discover our shared belief in the value of connectedness. We must demonstrate that collective international action not only works, but that it is in all of us and in our best interest. We must show the next generation that we are listening, that we have heard them, and we must not leave anyone behind. So therefore, I conclude, I challenge all the DHBs, all of the health sector, to now take the learnings from ADHB, from Gary's work, and proceed to discuss with the executive and their board in adopting the SDGs, because I believe that this is the way forward. It's a unified way forward, it's a consistent way forward, and aligns with all those social targets that we want to achieve over the next 10, 15 years. Because this is intergenerational, so everything we do now will benefit those who come after us. Thank you, Gary.
Thank you, Manjula. I'm going to hand back to Sophia. Yes, I can.
Awesome, great. It wasn't working this a few times. Hello, everyone. My name's Sofia White. I'm from Toitū Envirocare, and I had the great opportunity to work with the ADHB, Gary and Manjula, on their Sustainable Development Goals Alignment Project. I'm going to take you through the process that we undertook, a few of the reasons why, the benefits of it, and try and tell you a bit more about the goals. So Gary did mention that I would say something about the goals and a bit more about how they were created. So the UN SDGs were developed and published by 2015, and they evolved from a group of goals called the Millennium Development Goals, which were 8 goals that really focused on the root cause of extreme poverty worldwide, and they almost were kind of like so focused on the development world that they didn't really seem that applicable to every country, every sector, every organization. And the UN learned from that and went and did a huge consultation in order to develop the next set of goals that would transform the world to sustainability. And that's where we've got the UN SDGs now, the part of the 2030 Global Goals Agenda. And they were created in this big consultation, which included governments, NGOs, the private sector, as many organizations and people as possible to get this big input so that every goal would actually be, one, achievable, but also applicable to every context. So where do organizations start? Well, ideally, what you're not going to do is SDG bingo and just look at the goals and think, oh, I like this color, I like that, I think we're doing something kind of already like this, and shoehorn what you're already doing into the goals and say, okay, we're just going to focus on these 3 and we're not going to look at the other ones because we've already decided we're going to do these 3. If you do something like that, you're very likely to get accused of greenwashing or SDG washing. So the process that we took the ADHB on and we take our clients on has these key ingredients which make the process really successful. And the key ingredients are acknowledging your responsibility as an organization, being transparent, having integrity, being able to use your influence, choosing the issues that are most material to your organization, engaging and working with your stakeholders, being authentic, and showing leadership. And by going through that process and working with us, we were able to understand the ADHB's organization context within the context of the global goals and this economy, society, economy, the spheres of integration and interdisciplinariness that exist for the goals. The process is, I can communicate it in kind of 5 simple steps, which is assessing where you are now, looking at your organization's context, engaging with stakeholders, prioritizing the goals from feedback, and communicating these to your wider audience. So we go into more detail into these steps. Step 1 is about self-assessing. So for any organization, this is just looking at how mature your sustainability journey already is, what are your existing initiatives, and what are you already investing in, and what policies already exist, just so you can get a good look at your baseline, good look at what it is you're spending money on now. Because once you've done your stakeholder engagement, you might see that actually you're spending a heap of money on something that you're not actually having a really big impact on. And there's something else that you could actually invest in that would have much bigger implications and benefit a lot more people. Step 2 is understanding your organization's context. So this is looking at how within your value chain, from your suppliers to your customers to your patients, you understand the challenges and opportunities that flow within each of these steps, and that you can start aligning those to what these mean related to the goals. As Gary said earlier about zero hunger, behind each of these goals there are a lot of targets, and the name of the goal can sometimes make you think of something that disconnects you from that goal and makes you think, oh, that's not really relevant to us. But if you think of zero hunger, initially people might think, oh, that's to do with famine and starvation. It's definitely really focused on the third world, the developing world. But actually, if we think about it in a New Zealand context, it's actually to do with making sure that children are going to school, haven't had breakfast. It's making sure that every part of our society is well nourished and not exacerbating obesity. So it's about step 2 is understanding the context of your organization within the goals, and maybe even retranslating those goals into what's actually applicable to you. Step 3 is engaging with your stakeholders. Corporate or social responsibility is different to sustainable development, but it contributes to sustainable development by asking that organization to recognize what it is, what impacts they have, and how they can actually have a bigger impact to contribute to sustainable development. And the 2 pillars of that are engaging with your stakeholders and recognizing what it is that you need to be responsible for. And of course, your stakeholders aren't just your internal stakeholders, your employees or your board. It's really important to think about engaging with those stakeholders that often don't have a voice, such as future generations or weak or marginalized groups. But it's really good to engage with stakeholders from a broad sphere so you can get a really broad understanding of the impacts that you're having as an organization. Step 4, once you've got that stakeholder feedback, you can start to analyze it and understand it. And using that feedback, as Gary showed, you can start to get a sense of what issues are coming up as priority for you and a priority for your stakeholders. And that way you can start to put together a materiality matrix and identify the goals that are the most important for your organization. And finally, the final step is all about communication. Letting your stakeholders know the process you've been on, communicating back to your wider colleagues and peers. This step's might seem a bit like obvious, but it's just really important as part of this disclosing what you've done and being able to tell the sustainability story really well, as to say that we've chosen these goals. This is what they mean to us, and this is why. And finally, the process that we've created has been informed by 2 standards. It's the A1000 for stakeholder engagement, and we've also followed the guidance from ISO 26000, which is on corporate social responsibility. Our auditors have then assessed ADHB against this process and given them an assurance statement to say that they followed a robust process that's aligned to our programme's principles. So once you've got your priority goals, what comes next? Well, the next step is all about actually taking action. So now that you know what it is that you need to focus on, you can start to take action and follow in a very well-established like management system approach, the plan, do, check, act way. So that's the process that we take our clients on, and we went through with the ADHB, and it's been awesome to work with Gary and Manjula, and it's been such a success. So I want to thank them for being leaders in the health sector and taking this step, and also urge. I'm going to copy Manjula's challenge of saying it would be awesome to see the whole health sector to focus on the SDGs and start integrating them and taking action because of the wider benefits that it has, not just on health, but on everything else. These goals are integrated and they're indivisible. And if we can achieve all of them through the lens of good health and well-being, I think New Zealand will be in a really good place. So that's my section over. Back to you, Gary.
If there are any questions that people want to ask and put up there, we can put that up. We got another 6 minutes, so we've actually finished well ahead of time. I'm going to say 6 to 10 minutes we've actually got ahead of us. If anybody's got any questions, happy to take them, and either myself, Manjula, or Sophia to answer those questions. Thank you, Kennedy. Presentation so far on the goals and targets behind the goals indicators. They focus on local and national. Just localize the 231. To look at what are the key indicators for ADHB. I'm sorry, maybe I'm missing what you're actually asking here, Kennedy, but from the understanding that I have is that we are, once we've actually finalized on the 6 SDG goals, we're going to really look at the measurement stages next. So in that presentation that I did, we spoke about doing materiality first, then alignment, so making sure which are the SDG goals we want to focus on. Then there's a measurement phase where we actually look at those indicators under the ADHB and what indicators we are currently adopting, which ones we are currently measuring, and then see how we can roll those up. So I actually cannot answer that question. That's the next phase of the project. But Manjula, maybe you want to say something?
So, Kenny, we're just doing the 2021 budget planning, and part of that process includes key strategic themes, and each directorate within who adopt particular themes will then we will be able to list those particular programs and actions that align to the SDGs and setting out the targets. So out of those, is it 11 key goals and targets for health, we'll be able to determine which of the targets this DHB would actually monitor and measure progress.
Thank you. Yeah, good question. If there's any other questions. Well, there's a great question. What keeps you awake at night in terms of the most urgent specific problems that need to be solved? Well, right now, I think that every time I walk into the DHB, all I hear is coronavirus. And I think that that is indicative of what happens is we get a priority that is faced with us straight away and we have to deal to it. However, I think that the way that we are adapting and actually currently reacting to the coronavirus would be great if we can then take that same adaptation, that same mitigation, that same resilience and put that to climate change. That's the kind of stuff that I think we are starting to learn. We're making sure that our systems are all in place and our processes are correct. And if I had to say one thing that keeps me awake, it's about making sure we are really ready for what climate change is going to mean to us. And this example of coronavirus is one impact from climate change. And so I think that that's the one thing that keeps me awake. I don't know if that keeps Manjula awake or Sophia, but maybe you've got something else that keeps you awake.
I think as a country we have huge challenges ahead, and I think that we need better systems and joined up thinking. So, for example, our supply chain, and I know it will be under severe pressure at the moment through COVID. So we need to ensure from the learnings of COVID that our supply chain is solid. The frameworks there, we actually look at where our manufacturing bases are and ensure that we mitigate any risk to ensure supplies flow without hampering delivery of care, because that to me is something that does keep me awake, is ensuring supplies get to our site. And we've seen just in a recent couple of weeks ago, I think the country basically ran short of mask and gel. So these are two very key items that, as an example, and not to mention all the clinical supplies that go into running a hospital. But certainly I think there's a lot of learnings, as Gary mentioned, from COVID, and we will be taking those learnings in order to develop our mitigation and adaptation plans. But also, the good news is about when we have these discussions, Lahu, is that it helps us engage with other people and get that systems and that critical thinking that you need in order to solve problems. One person cannot solve a problem alone. As one leader, we need many leaders, and obviously we need many people to be connected with, and those key people then working on a solution.
That kind of segues really nicely into what I was going to say about what keeps me awake at night, which is the fact that the pace of change just isn't quick enough at the minute. I'm really worried that we're all aware of how urgent change needs to happen in a climate change context, in biodiversity context. And I'm kind of hopeful, having seen the reaction from coronavirus, that change is possible at a really fast scale when governments work together, when businesses work together, and everyone makes the right decisions. And so I think this coronavirus, although it's awful, is going to throw a lot of challenges, especially down the supply chain, as you say, Manjula. But I think we can learn a lot about working together and making action happen fast.
I think one of the other challenges is also the well-being of people. I think this is going to test a lot of people's well-being and mental health.
Mental health, yeah.
Yes, and we're aware of that. The heightened anxiety for the most vulnerable. We know the elderly are most affected through this virus. So this is another part of our adaptation, is how do we protect our most vulnerable in our community, as well as the mental health of our youth. We're also at a point where they are thinking, where is this going to go and how are we going to deal with it? And that it comes back to building resilience amongst our community of people.
Good question. Thank you, Leru. All right. If there's no other questions, I'm going to draw this webinar, this safe webinar, to a close and say thank you to everybody that has stayed online and for your questions. This recording has been done of this presentation. We'll send out the slides. If you have any other questions, please reach out. Great to have you all across here, and be safe. Take care, and thank you very much for joining in. Cheers.